all of you as wanted to talk to all of you. Oh yes, because was it Miranda asked this to be recorded, I think, because she couldn't be here. So we've been talking to the steering committee of the collaborative. We had a conversation, not similar, with the tri-chairs of the VBP compact work group, talking to some leadership at the health authority, and sort of really trying to think about, so we're halfway through this long period. We've been working for a long time, and some concern about what there is to show. I mean, there's good stuff, but I think not what we would all like to see. And so this question about, we have 4 more years, and should we be spending 4 more years doing this? How do we see a different outcome? What could we be doing differently? How could things be different so that we see more progress? We've in the past had a legislative champion. We haven't had that in years. We had Mitch Greenlake, we had Senator Steiner. We haven't had that in years. But just wanting to hear from all of you, and I'll ask Summer and Chris, see if I've missed anything, but really the question for all of you is, how can we see a different outcome? And what could we be doing differently? And what are your perspectives on all of this? So I will stop. Chris, Summer, please jump in with anything that I've missed.
Thank you, Diana. I think you pretty much summed it up, but just want to reiterate that, you mentioned the legislative requests, mandates, I guess, but it's in legislation that we make movement in these areas. And it just feels like, as Diana said, over halfway through and just don't have much / anything to show with regard to value-based payment movement. There's been a lot of work, and we just don't want to reach the end and look back and say, oh, we didn't do it. Everyone came to the table to meetings. Well, actually not everyone, but often we had people come, but what do we have to show for it? And it's the amount of work this requires from all of you and us, from all of you who show up, and from us is pretty significant. So we just felt it was time to call the question. Summer, do you have anything to add?
No, I don't have anything.
So open to all of you for your to weigh in.
So can I speak?
Go,
so we're an advisory committee. We're only going to make as much progress as our advice is adopted. And I've heard a couple members that used to join early on that it didn't feel like it was a useful time because of the lack of progress. And honestly, I've felt that too, but every time I think about stopping participating, I think about how badly I want to make sure Southern Oregon has a voice. So that's what keeps me pushing on. But I just, I don't know, we do make progress on advice sometimes. The diverse group sometimes makes progress on advice slow too. But I guess I see the lack of progress as being an advisory committee.
Yeah, that's helpful, Christy. Go ahead, Ruben.
Just out of curiosity, what would you have expected by now? Like, what would success up to now have looked like? Because I kind of agree. I had seen us more as like an advisory committee, a place to maybe champion certain thoughts on primary care, but ultimately it's a really hard area to legislate because there's lots of different payers, and lots of different payers have different contracts, and if you do anything too narrow, you're going to just get people bailing. on the process. So that, I guess that's what I was like, what was hoped for to be achieved by this process, by this time?
Chris, do you want to jump in on that? Or go ahead.
Yeah, I guess I would just say that, you know, to have one recommended model that was, I don't know what verb we use, but was signed on to, I don't know if endorsed was the word we used in 2018, 19, and then didn't go anywhere, and now be in this kind of similar situation where we're developing another model, but you know, we haven't reached the end, but it's there's certainly been pushback, and I'll remain hopeful until we get to a point where it can't be, but it's not it's not felt like there's been kind of universal agreement to kind of adopt the model. I think we were hoping to see actual movement that is supported through the collaborative conversations and recommendations to increase adoption of value-based payment and the aligned model. So that's what the legislation says. And I hear you both, Christy and Ruben, on the advisory nature of this, but the entities at the table, payers and providers, have the choice to adopt the models. And I think that's what I would expect to occur. And I think if we get to the end of 10 years and there has not been alignment, adoption and alignment around value-based payment, this collaborative won't have been successful. That's, maybe I'm being too hard, setting expectations too high, but that's what I personally feel.
And let me just, because Liz just joined. So Liz, just without going over everything I just said, we're asking for perspectives from this group about how, similar to what we talked about in the VBP compact work chairs, but how do we see a different outcome? We have 4 more years of this work. We've been doing it for 7 years. What could we be doing differently to sort of counter what we see as waning commitment and engagement? And I think that's the other thing, Ruben, I think Chris is right on. And I think we've seen our numbers of participants go down, and then we have a bunch of people who who don't put their cameras on and don't speak. And so we just have a bunch of people who are just sitting there and not participating. So we're not getting their engagement. So I would say that's another piece. I think Deborah had something, and then I'll go to Christy. Deborah, did you have something?
Not anything meaningful. I'm still digesting, like you know, you just threw out a really simple question, right? Like, how do we make success out of something we've been working on for 6 plus years? And so really, I think it's hard. It's voluntary, and you have all of the unique situations, and folks, including us, think, well, we want to adopt this, but we need to consider X, Y, and Z because we're unique, which whether or not we're unique, you know, is out for, you know, to the jury. But it's difficult because we have very different markets that are coming together, and it is so important for adoption to be aligned. And so, you know, this last month, I've been in a lot of different conferences and discussions related to, you know, value-based payment and from across the nation. And, you know, Oregon is still looked at as a leader in terms of the work that we're doing. And I think what's unique and different is this collaborative, is this discussion that is allowing people to be at the table, to think more broadly. But there are other places in the country that adopt it differently. And I would say that what I have heard is, number one, it's most effective in Medicare Advantage because of the dollars associated with it and the push that the government has to push some incentives to specific models to I can't even, I don't know if it's successful or not. We don't participate in those because we can't, you know, and so So all of the discussion about those, especially when it includes total cost of care, relates to Medicare Advantage or Medicare. It gets very difficult, and I hear it consistently, that the multi-payer, like the problem in adoption is it's not aligned, which we've said. But the problem in it not being aligned is there's all kinds of payers and products, and there's so many unique situations that then make it but I can't do it here. So whether it's the self-insured, and then that's a huge proportion of the products offered by different health plans, or you have employer groups that want to do something unique and different for just that employer group. And so it gets really tricky to make that align, but it will not be successful if it is not, because you can't have your feet in two different buckets. You can make incremental change, but it'll be very, very difficult at the provider level to have your feet in two different buckets. So I don't know. I mean, is it that it's want multiple models to choose from, so it's A, B, or C, or I don't know, but I'm sorry, I'm just kind of speaking because I'm digesting while I'm talking. I'm still trying to comprehend what I've heard in the last month, because I want to apply this. I just haven't found the right way yet.
Deborah, and I think if this was simple, we'd come to you with a recommendation, like, here's what we hear, I think it's not simple. So let's go ahead, Christy, you had your hand up.
Yeah, hi. Gosh, Deborah just said so many things that are so on the target. And I think that she and I are in several meetings together. And I was thinking about that this issue always comes back to that it's virtually impossible to get alignment, like she said, because the payers have so many different models of reimbursement, and the self-insured is definitely one thing that keeps coming up. And for me, I think about, I go back to, I think it was 2014 when we were working on the idea of shared investment across payers and providers. And Diana, you were there, and everybody agreed that we should share in this, but in the end, nobody would sign on the dotted line. And I just think that payers and providers are not going to come eye to eye on this. And additionally, I can tell you that I work with a privately owned clinic, and we are really, really struggling down here. We do not have enough providers to take care of our patients. They're retiring and we can't attract more. And the cost of staff is going up, and the cost of supplies is going up, and Medicare is reducing reimbursement, which means commercial payers are following. And, we're trying to figure out how to survive, not and I've spoken to other clinics, some of them up north too. So I know it's not just a Southern Oregon thing. There are a few of us who've been in on this since the beginning of CPC and PCH. We all jumped on and said, this is working out great for us. We didn't think we could be a quality improvement machine, but here we are, and we're all going, let's get off this train. We're tired. We're really tired, and we can't keep figuring out how to do more with less.
So Chris had her hand up, and then I want to check in with Danielle and Liz.
And this is also helpful. What does success look like for the collaborative? I'd like us to keep that in mind and love to get your input on that. And is it about recommendations and advice or action? And I think those are two things I didn't see at the beginning that I just want to add to this conversation.
And Chris, I would even add, although I think, just given what I think maybe Deborah said, is it, I don't know if this is enough, but where is it just a table for payers and providers to talk? And is that sufficient? And I don't know that is for all the time, energy, and resources that go to this.
Well, if that's the case, if I could just respond, if that's the case, that has a different impact on staffing,
Exactly.
much less of an impact. I mean, we can offer it, we can offer a table
But does it meet the legislative intent as well?
Correct.
That's the other thing. So wanted to, Danielle and Liz, if you want to weigh in, because we have about 10 minutes. And so what want to hear from the two of you and then sort of figure out some next steps. And the next step could be bringing all of you back together, but this has already been really helpful. So Danielle and then Liz.
Yeah, I mean, I don't have a whole lot more to offer. I mean, I think, Chris, to your point, I was reflecting on it, you know, what we've been to where we are. And in the VBP space, I mean, I think we're all struggling a little bit in this space, right? From just even trying to roll it out for our health centers. We actually ended up sunsetting our VBP committee, right? So, and it's not all about that, right? I mean, to be clear, that's not, but that's what we certainly have been focusing on and trying to provide input to. So I think the struggle for me, and where we're supporting our members as well, is there is the VBP compact work, right? I mean, there's a whole subset here that's doing some of this work. And I think it's a matter of where does this group continue to fit into? And we tried, right? We wanted the liaison, we did. And maybe that's what's not coming through to the greater membership, right? Is that there really was some work to try to figure out the alignment. But I also appreciate, I think, having the payer and provider conversation, right? I mean, I think there is some value to, and Chris, to your point, it would be different to staff that. But I'm also worried to say we let it go because this is just one iteration of payment reform too, right? I think what we all know, and Chrissy, what you kind of highlighted too, right, is there's multiple payers, multiple ways. We've been moving this direction for 10 plus years, right? VBP has been the shift of where we're moving to, or the continuum of movement. But yeah, we are losing a little bit of that traction, but I think the VBP compact and some of the models and work that's happening is also picking up some of that slack. So
Thanks.
that adds a whole lot.
No, it's good. Liz.
Yeah, a couple of things. Circling back to Chris's question as what does success look like? To me, it is a roadmap, a model for what a group with lots of varied lenses have put together as most likely to succeed for the most people. That to me would be success. And I think whether that translates into action is really, again, this is just my opinion, but it's outside the scope of the Payment Reform Collaborative, because I really do think if this is how people get paid, they will be engaged. And that is something that could be legislated or might be market driven. But what it feels important to me that the Primary Care Payment Reform Collaborative be able to stand up a roadmap, a suggestion for a model, and supports that need to be in place for primary care to thrive. So not just survive, not just like turn on that wheel until we fall off dead, but like thrive. So to me, success is shining a light, providing a roadmap. Not so much the roadmap like the VBP Compact is looking to do, but with a primary care lens. This is how we thrive. This is how we get to lowering total cost of care, bending the cost curve, is by this investment in primary care and holding it up in a way that it can sustain long-term as this high value quality improvement machine that brings great satisfaction to patients and to the staff and the providers providing that care, because that's foundational. That quintuple aim we're talking about, right? OPCA had a quadruple aim before we included staff and provider wellness. And so now we're doing the quintuple because you can get equity in there too. But like, that's what we need. We need to shine a light. We need to show the way.
That's great, Liz. Thank you so much. Deborah.
Just one other thing in terms of success, you know, and I can't, perhaps this is coming from the VBP work group that's looking at the primary care model itself. I wonder, you know, what I think could be helpful is to have it it as a starting point to say, this is what was agreed on by a group that wanted to invest in primary care. These are the components that would make it be successful. And so you might take some of these different components, whether it's how you're paid fee for services, whether it's fee for service or capitated, what needs to be in place for quality measures, what needs to be in place if you're considering cost, or, you know, all of these different elements. And whether it's a menu set or it's a starting point for the conversation, so that you at least start with alignment and then still allow for that flexibility to tweak with the payers, as long as it's a conversation. Like, this is our starting point for your contract. Now you can, you know, work with the payer, work with your relationships to tweak it from there. You know, maybe it's not like, here's the model, use it, but maybe it's how we frame how to use the model.
Mm-hmm. That's really, yeah, and we've had some of those conversations recently in the planning team, Deborah. So like, what are not the bare bones, because that doesn't sound right, but what is sort of the framework almost that you're building the rest of the house on, and that if everybody has at least the same foundation, right? And then they can, with some of these columns here and there, then they can do other things they want. So we are almost at time, and really appreciate everybody's time. And so I'm trying to think about some good next steps. And Chris, Summer, I don't know if you have thoughts. I mean, I think this has been very useful. One of the things that came to mind is, and I don't know when this group meets again, but maybe we need to have a conversation with the collaborative about what success looks like. Like, how would and hope that we get some engagement, but what does success look like? Or maybe Chris is going to be having some conversations at OHA about their perspectives too. We got some good perspectives from the VBP Compact Tri-Chairs, but I'm trying to think about next steps. Like, we can take this and put it in the pot of the stuff we're thinking about, and then maybe bring it back to all of you. Summer, I don't know when this group yet comes back together again, but this certainly feels like really good feedback as a starting point. Chris, what do you think?
Yeah, I like the idea of having this conversation at the collaborative, and giving folks a heads up, you know, that it's going to be, I mean, obviously we always send the agendas out, but just so people, you know, and ask them to really prioritize attending. And we're really thinking about kind of the purpose of the collaborative and how to, you know, move forward in a way that's going to set us up for success.
Deborah, did you have your hand up from before, or a new hand? Go for it.
New. Just really quickly, like with that, because, you know, I feel like I just gave you an off the cuff answer without, you know, just my gut reaction from the moment. I wonder, how good are people at returning surveys? Because I mean, either if it's done in advance or done after, you know, to share the importance, like maybe you have the conversation and follow up with the survey, or you do it in advance to have a leading point for the conversation. I wonder if there's a way to do that.
I think actually with the collaborative, I feel like the last time we did a survey, it wasn't terrible. I think we got some responses. Summer, is that like, that was a year and a half ago. I think we got, so I was thinking the same thing, Deborah, is maybe we send out a survey and like, it's 5-minute survey, right? It takes 5 minutes to complete, and just, you know, how do you measure the success of the collaborative? Why do you continue to come? You know, what are your, here's the goals of the collaborative. What do you think do you think they're realistic? That kind of thing. That's it. What do folks think about maybe doing a survey in advance of the April meeting? Yeah.
The surveys that are scariest and take the longest are those open-ended questions.
So just yes, no,
So,
yeah, okay.
I like options. If you can give like, here are 5 options and here's an other. It gets you thinking, it's more likely to get you to fill in the other, and it doesn't take as long as if you just give me 3 blank questions, and that's likely to take me more than 5 minutes because
Perfect.
it's just overwhelming.
Yeah, that's great.
This group meets again on March 20th, and the collaborative meets again on April 12th.
Okay, so that's helpful, because we will definitely bring some things back to you by March 20th, but I think maybe we will start with a survey of the collaborative if everybody's on board with that. I think we could do that. All right, It's 1 o'clock. You all are often awesome for showing up consistently. And I thought, Deborah, I thought you were going to go here. If you have additional thoughts and you just want to shoot us an email, 1000% welcome to, or give one of us a call and just chat. We can, because we do realize this is just fast and here it is. So welcome you to take more time to ruminate and share your thoughts. Thank you all so much. Really appreciate it.
Thank you.
Bye.
Bye.
Thanks.